Those of the district health authorities, IWK, and government have accepted Ernst & Young's recommendation to proceed to service delivery model and business case level of analysis for the following 6 services: human resources, general administration, supply chain materials management, information technology and telecommunications, finance, including payroll, and laundry. Ernst & Young recommended these areas based on the following analysis of the criteria: the impact on cost potential, the impact on patient care and service, the impact on people, and the impact on communities where the DHAs currently reside. Ernst & Young will now develop the best practice service delivery model and the business case for each of these 6 services. Because we are in the service delivery model and business case development phase, we do not yet know how many jobs will be impacted, or specifically how the delivery of the services will change. We do know that jobs will be impacted. In addressing the job impact, we will follow collective agreements. For unionized staff, we will follow terms and conditions of employment. For management and excluded staff, and we will follow personal services contracts where they exist for executive staff. I recognize this causes worry and anxiety among all levels of staff: executive, management, and bargaining unit. We cannot predict cost savings at this point until the service delivery model and the business case is completed for each of the 6 services. The business cases will identify the impact on jobs and the impact on costs, as well as the impact on patient care and impact on communities where the DHAs exist. The reality is that we have less funding available to the DHAs and the IWK. We are now operating in the current year with a 0% budget, basically the same money as last year. And going into next year, we are looking at a -3% decrease in funding. We have kept staff and unions informed on the major milestones and will continue to do so throughout this process. The next step in the process is for the CEOs to evaluate the service delivery models and the respective business cases for the 6 services and make a recommendation to government in the new year. That's my statement. We will now be pleased to answer any questions.
So you don't know how much money you're looking to save here? How can you move forward not having any target whatsoever?
There's been no target set. We approached this exercise, this examination, looking at what the best evidence suggests in terms of the potential for cost savings. So Ernst & Young has been looking at all of our services. The 13 services are in scope, and looked at what those services cost in other provinces. So they looked at what the best practice was in terms of delivering those services, identified the gap, and that gap, as well as consideration of the impact on service quality, people and communities, is how we identified the first 6 of these services to go to business case development and service delivery model.
So in coming down to this 6, it was a balance between trying to gauge the impact on patient services and the cost savings. Is that?
Well, actually, there's 4 criteria that we use to evaluate all 13, which led to the 6. Cost reduction potential was given the highest weighting, because that's what this is about, is using potential savings that may come out of this to reduce our costs in the administrative support areas in order that we can protect patient care. The second criterion was impact on service and impact on patient care. Third criterion was impact on our people, and the 4th criterion was impact on the communities where the DHAs reside.
When you say impact on people, impact on the employees.
Exactly. Employees. And that includes the executive staff, that includes the management staff, and that includes bargaining unit. What we do know, based on the work that Ernst & Young has done to date, that these type of initiatives disproportionately impact executive and management in terms of job loss.
How many jobs would these 6 areas represent?
It's approximately 3,000 in terms of the total number of jobs. In the 13 services.
Oh, I'm talking about the 6.
It's about 1,800 or so in the 6 services.
This is not a lot of time, actually. It's less than a month before you were going to be coming back to government. What will you actually deliver to government?
Well, what we'll deliver to government after the Ernst & Young makes its recommendations to the CEOs, and the CEOs evaluate those recommendations, is recommend to government the best practice service delivery model, recommend business cases which will be looking at the cost savings, looking at the impact on our staff, looking at the impact on communities we serve, and looking at the impact on quality and service. And we'll recommend a model. The CEOs are recommending. Clearly, the government is doing the approving.
Gotcha. I take your caveat. Let's take something that the public might understand. You privatize laundry service. Let's say you do that. What will you, if that's the decision that you decide to go with, how will you describe that to government?
Well, I think that's highly speculative at this point in terms of any service delivery model. That's why we're
You're
doing
good for another month.
That's why we're doing an examination in terms of looking at what is best practice service delivery model. And until such time as the consultants make recommendations and until the CEOs recommend those recommendations in terms of service delivery model to government, I can't speculate on what that might be.
Are you ruling out privatization of any of these services?
Outsourcing is in scope in terms of this examination. So we're looking at a number of different alternative service delivery models, which could be a decentralized model, a centralized model, or an outsourced model. And that was in the RFP that was issued, and that's what the consultants have asked to do in terms of looking at what's best practice.
Can you release to the public what it is that Ernst & Young has sent out so far? Can
No.
you see that?
No, I cannot.
Why not?
This is confidential advice to the minister, and until such time as the minister and government chooses to release this, I'm not authorized to do that.
And when you make your recommendations to the province, will you be releasing all of the data that you're using to support this? And what I'm getting at there is whatever Ernst & Young hasn't done to date, presumably there's still stuff for them to do, will you release that as well?
Well, there's considerable work to be done. At this point, the milestone we're talking about is going from 13 services to 6. Now what we're doing is looking at the service delivery model and the business case for each of the 6. So we've achieved basically one of 3 major milestones. At that point in time, when we do receive the report back in terms of what the recommended service delivery model is and the business cases, we will fully disclose to the CEOs and to the government in terms of what the best evidence is behind those recommendations.
And you're draping this in consultants' language as we're talking about this now, but you know that there's obviously far more at stake than just consultants' language about this. Could you please put this in perspective in terms of how big a change that you're looking at bringing down in the new year? Can you talk to me a little bit? This is a big deal, isn't it?
Well, it certainly is. And -3 is a lot of money to find in a system as well. And we are trying our best to protect vital programs and services and minimize the impact on patient care.